Good morning, Julia and Neetha. It's 11 o'clock. 11 o'clock Eastern Standard, 12 noon Atlantic. You're welcome to begin.
Hi everyone, my name is Neetha Dick, and I have the privilege of serving as the Dean of the College of Nursing at the University of Manitoba. As a member of CASN's Research and Scholarship Committee, I'm delighted to welcome you to the November session of the 2019-2020 Lunch and Learn series. I'm sure many of us are familiar with the concept of the Lunch and Learn, where faculty members come together during their lunch hour to share with one another projects they're working on, and to dialogue and discuss methodologies, successes, and challenges they've encountered in their work. This webinar series is intended to serve as an inspiration and a networking opportunity for participants, while recreating the collegial feel of a lunch and learn. This year, the theme of each session will highlight one of CASN's national research priorities for nursing. Today, for this third session of the 2019-2020 series, the theme is Nursing Research Priority Number 3, Home Care and Primary Health Care Nursing. I'm very pleased to welcome and introduce our presenter for this session, Dr. Julia Lukowicz. Dr. Lukowicz completed her PhD in nursing at Queen's University under the supervision of Dr. Joan Tranmer. Her program of research focuses on the integration and optimization of nursing within the primary care setting, specifically focusing on chronic disease management. She has expertise in quantitative methods, including cross-sectional designs, systematic reviews, and secondary data analysis. Dr. Lukowicz is a recipient of several awards and scholarships, including the 2017 Council of Ontario University Programs of Nursing Doctoral Research Dissertation Award. In April 2018, she assumed the position of President-elect for the Canadian Family Practice Nurses Association. In collaboration with the association, as well as the Canadian Nurses Association and an expert team of researchers, Dr. Lukowicz led the development of a defined set of national family practice nursing competencies. Dr. Lukowicz's clinical background includes emergency room and primary care nursing. During today's webinar, titled National Competencies for Registered Nurses in Primary Care, Dr. Lukowicz will speak to the role and competencies required of family practice nurses. Also known as primary care nurses, family practice nurses are registered nurses who practice in primary care settings, such as clinics, offices, family health teams, and community health centers. Family practice nurses improve access to primary care and continuity of care, reduce healthcare costs, and promote high-quality care. On completion of this presentation, you'll be able to describe the current state of RNs in primary care across Canada. You'll understand the importance of competencies that reflect the unique practice of registered nurses in primary care, and you'll apply competencies to support the professional practice of RNs in primary care across various settings. Following Dr. Lukowicz's presentation, we will have time for questions. To submit your question for Julia, please use the question and answer function on your screen. And once you finish typing your question, remember to click the send button. I'll now turn the session over to Dr. Lukowicz to begin her presentation. Thank you, Julia.
Thank you, Neetha. Just wanted to start off by saying good morning to everybody, or afternoon if you're out here in Atlantic Canada, and say thank you to CASN for the opportunity to participate in this 2019-2020 Lunch and Learn series that's presented by the CASN's Research and Scholarship Committee. So today I will be presenting on a project that I completed as part of my program of research that investigates the integration of registered nurses in primary care, as well as examining ways to maximize the role of registered nurses in the setting. In particular, I'm going to present on a project that is near completion that focused on the development of national competencies for registered nurses in primary care. So as Neetha just nicely introduced, and as indicated in the promotional abstract for today's webinar, the objectives that I will cover are to describe the current state of registered nurses in primary care across Canada. Secondly, to understand the importance of competencies that reflect the unique practice of registered nurses in primary care. And finally, to apply these competencies to support the professional practice of registered nurses in primary care across various settings, including practice, education, and policy. So this project would not have been successful without the various team members, funding, project partners, and participants. So I wanted to take a moment to acknowledge the national research team that I was privileged to work closely with over the last year, which included nurses that represented clinical practice, policy, research, education, as well as funding support that was received from the Canadian Institutes of Health Research, the CFPNA, CASN, and CNA in either the form of cash or in-kind contributions. Most importantly, though, I want to forward a thank you to all the Delphi participants that completed both rounds of the Delphi survey. So this is the method that I will describe a little bit further in detail later on in the presentation, where participants across Canada completed 2 survey rounds, which ultimately led to the national set of competencies that I'm presenting today. So across Canada, there are numerous issues facing our healthcare systems. Patients are increasingly complex. The prevalence of chronic diseases is increasing. There's low physician retention and high turnover in rural communities, which impacts continuity of care. Many physicians are still practicing in solo practices without the support of other healthcare providers. And there's an impact of all these issues on quality, access, and cost of care. So a competent registered nursing workforce providing care within teams represents a feasible and affordable solution to address many of these issues. Registered nurses in primary care are commonly known as family practice nurses or primary care nurses, and these terms are used interchangeably across provinces and territories, and you'll see them used interchangeably within different reports, literature, and documents. The term family practice nurse aligns with the national association that represents this group of nurses and provides leadership on their behalf, namely the Canadian Family Practice Nurses Association. So to briefly define an important concept for today's presentation, I'm going to describe what primary care is. So this is where you go to receive care from your family doctor or your nurse practitioner. It's a component of primary health care, and it's considered the first line of clinical services. Primary care should be the entry point into the healthcare system. It focuses on the delivery of health promotion, disease prevention, and the management of episodic and chronic conditions. This is the setting where chronic conditions should be managed. Primary care is often delivered in a clinic or office setting, such as family health teams and community health centers. So registered nurses make key contributions within primary care teams across Canada. They work in partnership with physicians, nurse practitioners, and other healthcare providers who are part of the team. They function as generalists in diverse practices across the breadth of primary care services, and they deliver a broad range of health services, including health education, health promotion, chronic disease management and prevention, therapeutic interventions such as wound care and immunizations, medication management, pediatric and women's health, referral management, care coordination, and system navigation, to name a few. Family practice nursing falls under the umbrella of community health nursing, which supports the health and well-being of individuals, families, groups, communities, populations, and systems. Other areas of community health nursing include public health, home care, and community nursing, which you often find in rural and remote areas across Canada. Emerging literature is demonstrating the benefits of family practice nurses in primary care, which is creating a greater and stronger argument for the need to prepare this workforce to work in primary care and to further integrate them within primary care teams. To date, research has demonstrated that RNs in primary care can improve access to care, improve quality of care, improve cost effectiveness, enhance physician satisfaction, and most importantly, improve patient satisfaction. So where are we now? Globally, this is increasingly a role that you'll find in primary care teams. In Canada, team-based models of care that incorporate RNs are present in various degrees across provinces and territories. For example, in Alberta, Nova Scotia, and Ontario, RNs form the core primary care teams. In fact, they're the most common non-physician provider that you'll find in this setting. However, other provinces across Canada have been much slower implementing this role, such as Newfoundland and Labrador, where I am located, as well as British Columbia. A major barrier to further integration of this role is the lack of evidence information on family practice nursing, contributing to their underutilization and missed opportunities to provide high-quality care. So my program of research is focused on increasing knowledge in this area. We need a better workforce data to improve tracking, planning, and reporting. Currently, data related to registered nurses in primary care is either combined with that of nurse practitioners or falls under the umbrella of community health nursing. So it's very difficult to tease out that specific role of RNs in primary care. We also need a better understanding of the optimal role of nurses in primary care and to measure outcomes that relate to family practice nursing specifically. This is also becoming increasingly important with the patient medical home model, also known as health home or different terms in other provinces and territories. As the patient's medical home becomes increasingly adopted and integrated across Canada, there's a need to identify indicators to evaluate its success. And this is an ideal opportunity to examine RN's contribution within the patient medical home, ensure that it's clearly articulated. And lastly, we need to define a set of competencies for registered nurses in primary care. In fact, the absence of national competencies for RNs in primary care has been a fundamental challenge to the integration of this role in primary care teams. So what are competencies? Many of us are already familiar with this term, but for review, they are defined as the integrated knowledge, skills, judgment, and attributes required of a nurse to practice safely and ethically in a distinct role or setting, such as primary care, public health, home care, critical care, or other areas of nursing. They define the scope and depth of practice and provide a framework for establishing baselines, measuring performance, and forming job descriptions. Competencies are sandwiched between standards of practice and roles and activities. Roles and activities are much more specific than competencies and would reflect the actual functions and tasks that a nurse is performing in a setting. Competency statements are a little bit more broad, and standards are even more broader than that. Currently, competencies exist for other areas of community health nursing, such as home care and public health. They have not been developed yet for family practice nursing. So this is a figure within the newly updated and revised standards of practice for community health nursing in Canada. So one of the key updates in this updated and revised version of the standards of practice was the integration of RNs in primary care. So this is a really exciting time for registered nurses in primary care to see this integrated into this document. The blue circle on this in this figure represents the provincial regulatory standards. So this would include standards and guidelines that are produced by the College of Nurses of Ontario, for example. The mustard yellow circle in this figure represents the community health nursing standards, which define specific expectations for nurses working in the community. The three small overlapping circles represent competencies, which are the knowledge, skills, and judgments to meet standards for home health, public health, and family practice nursing. These are derived from the community health nursing standards and guide practice in these specific areas. The development of competencies for registered nurses in primary care is a key recommendation that was identified by different organizations that provide leadership for RNs in Canada, specifically within the reports identified on the slide and by the Canadian Family Practice Nurses Association strategic plan. So there are various benefits of national competencies, including support and integration, to support the integration and optimization of RNs within primary care across Canada. Competencies will help articulate the unique contributions of RNs who work within primary care. It will contribute to a competent national workforce of RNs in primary care and serve as a tool for facilitating the interprofessional team functioning by providing role clarity and articulating scope of practice. Competencies will also help employers with recruitment and integration of RNs into primary care settings through the formation of job descriptions, credentialing mechanisms, interview guides, orientation materials, and other different types of tools. and will also serve as a framework for performance evaluation for employers, researchers, or other stakeholders to generate evidence on the effectiveness of RNs in primary care. And lastly, competencies will be used to help guide nursing curricula across Canada regarding content related to RNs in primary care, both at an undergraduate and postgraduate level. Ultimately, the goal of competency development for RNs in primary care is certification. So it's the hope that these competencies will create an opportunity for RNs in primary care to be certified through the Canadian Nurses Association Community Health Nursing Certification Exam. This exam is currently being updated, and they're using the newly revised standards of practice for community health nurses in Canada, which now include family practice nurses. So for the remainder of the presentation, I'm going to take you through the path that was taken to develop competencies for registered nurses in primary care and provide an update and a summary of where we are today. So this project really hit the ground running in May 2017 when I hosted a key stakeholder meeting in Winnipeg, Manitoba. I brought together individual nursing leaders and individuals across Canada that represented different domains of nursing and who had expertise in primary care. Participants represented academia, represented clinical practice, policy, administration, leadership, and we all got together and discussed the importance for competencies and made a plan for moving forward. This meeting was supported with funding through a public engagement grant at Memorial University and contributions from the Canadian Family Practice Nurses Association. Key outcomes from this meeting included the identification of a need for a comprehensive and systematic approach for competency development. It resulted in strengthened partnerships between academics, researchers, clinicians, and knowledge users, and stakeholder engagement and a plan to secure funding. So a project grant was prepared and was successful through the Canadian Institutes for Health Research, and this grant was used to support project activities. One of the components of the funding was to develop competencies that reflect the unique contributions of RNs in primary care to support the integration and optimization of this role within primary care across Canada. This method involved two different phases. First, an initial draft of competencies was developed, and this was guided by an environmental scan of international literature related to family practice nurses, as well as a panel of key informants, which was comprised of researchers, stakeholders, and project partners. The second step in this competency development was a Delphi approach, which is a consensus process used to obtain national agreement. So the environmental scan is published in the Canadian Journal of Nursing Leadership, and this was done to identify literature internationally that reported on a set of competencies for registered nurses who work in primary care. 9 articles were identified from different countries, including Australia, the United Kingdom, New Zealand, Brazil, South Africa, Thailand, and Canada. Overall, the development of family practice nursing competencies was found to lag in Canada in comparison to international work. And the work that was found in Canada was conducted at a jurisdictional level. So there were no competencies yet identified at a national level in any capacity in Canada. Within the Canadian literature, there were 2 specific isolated initiatives that were found. In Nova Scotia, the Registered Nurse Professional Development Centre has developed competencies for their postgraduate family practice nursing program. And in Ontario, there was a team of researchers who in 2010 developed a competency framework consisting of 6 distinct domains, which included professional, expert, communicator, synergist, health educator, and lifelong learner. So findings from this environmental scan were only one component that informed the initial draft of competencies. A panel of key informants comprised of all study team members and project partners with expertise and experience in primary care nursing met in person for a full-day professionally facilitated workshop in Toronto, Ontario. We reviewed findings from the environmental scan and competencies of related practice areas and developed an initial draft of competency statements that included 49 different statements. An explicit effort was made by the panel to avoid duplication or overlap with existing published competencies in similar areas. This initial draft of competencies then underwent a Delphi process. There was 2 survey rounds, both online using Lime survey software, and it was offered in both English and French to ensure that we were able to capture all of Canada. Participants included individuals with expertise, knowledge, experience in the roles or contributions of RNs in primary care. We sought representatives from all provinces and territories and all domains of nursing, including practice, research, education, policy, and administration. Participants for the Delphi panel were identified through snowball sampling, through the team of researchers and our networks, online searches, and professional organizations such as the CFPNA and the provincial groups. Each participant was asked to report on their level of agreement with each of the 49 competency statements on a 6-point Likert scale. 1 indicated that the competency statement was not at all important, and 6 indicated that the competency statement was extremely important. They also had an opportunity to provide comments and suggestions in an open text box. Consensus on a statement was defined as at least 80% agreement or a mean score of at least 5. So as I previously mentioned, there was 2 survey rounds. 137 individuals were identified through the snowball sampling, online searches, and professional associations, and 86 of those individuals completed the first survey for a response rate of 63%. This was conducted between April and May of 2019. This was then followed by a second survey in which 72 of those 86 panel members participated for an 84% response rate, which took place between June and August. The majority of statements achieved agreement after the first survey. However, those that did not achieve a score of at least 5 were reviewed and revised by the research team during a teleconference meeting, and these underwent review in the second and final round of the Delphi survey. The final set of competency statements is comprised of 47 statements, and they're organized into the following 6 domains, including professionalism, clinical practice, communication, collaboration and partnership, quality assurance, evaluation and research, and leadership. So all the competency statements are organized within these different domains or categories. The final report is currently being finalized. We're seeking approval from project partners and finalizing a dissemination plan and a launch date. So for the purpose of this presentation, I'm only able to share examples from each of these domains of competency statements. So with respect to domain 1, professionalism, an example of a competency statement that falls within this domain is to advocate for nursing role optimization within interprofessional primary care practice. With regards to domain 2, clinical practice, an example of a competency statement is to educate patients on resources and tools for self-management of their health and well-being. In regards to domain 3, communication, one of the competency statements is to exchange knowledge amongst interprofessional team members to promote excellence in primary care practice. With respect to domain 4, collaboration and partnership, one of the competency statements is to understand the roles and responsibilities of regulated and unregulated healthcare providers involved in interprofessional primary care teams. An example of a competency statement within domain 5 is to understand quality performance indicators for primary care practice. And with respect to domain 6, leadership, an example of a statement is to participate in coordination of the development and or implementation of primary care-based programs to support health promotion, disease prevention, and rehabilitation. So in total, as I previously mentioned, there's 47 statements contained in the final set of competencies, and this is just a snapshot of 6 of them. So the CFPNA and project partners are currently establishing a plan for dissemination of this report, and it's going to be coming very soon. The report is currently being translated into French, and the report will be available on the CFPNA website. We are hoping to launch the report in December through a CNA webinar, but this is a tentative plan, and communication of how it will be disseminated will be promoted and shared soon. So the CIHR project grant that was received included funding to develop the competencies, but it also included some funding to do further work to validate and explore how these competencies are implemented and actualized across Canada. So the next steps involve 2 national surveys. One survey will be of undergraduate, baccalaureate, and postgraduate family practice nursing programs to assess the degree to which the identified competencies are integrated into these curriculums. This will provide an opportunity to identify ways to optimize content related to primary care nursing within undergraduate programs. Currently, you get snapshots of it within community health nursing courses in general, but there is the potential to identify gaps to better improve this content within curriculums and better prepare a primary care nursing workforce in that aspect. The second national survey will be sent to family practice nurses to identify their current learning needs with respect to these competencies, as well as to identify which competencies are being actualized by family practice nurses in primary care. We have also received funding through a CIHR Knowledge Translation and Dissemination Grant to communicate and promote these competencies nationally and internationally. Funding will support development of infographics targeted at different stakeholder groups, such as patients, policymakers, and providers. Includes funding support, including some in-kind support from CHNC and CNA to conduct a webinar using their platform. So we're planning a CNA webinar in December to officially launch the final set of competencies in the report. A journal publication will be prepared that will detail the methods and research findings of the competency development process in more detail, as well as conference presentations provincially, nationally, and internationally. So before I wrap up and open up the floor for discussion and questions, I just wanted to put a plug in for CFPNA membership. I think, CFPNA, for those of you who are not familiar with it, is a national association that provides a voice for RNs in primary care. They are a full network member and a specialty interest group of the Canadian Nurses Association. Membership includes opportunities to network with family practice nurses across Canada, support your professional association, and this type of work that's advancing family practice nursing in Canada. So in summary, the health needs of Canadians and ongoing reforms to strengthen primary care require an RN workforce that is well defined and understood within the healthcare system. The development of competencies is one strategy to help support this need. The competencies will hopefully result in certification opportunities through the Canadian Nurses Association. And these competencies will also help inform organizations and provincial governments in actions targeted at the integration and optimization of RNs within primary care and help shape the development of competencies for RNs in primary care internationally where they have yet to be developed. Thank you, and I'm happy to take any questions or comments.
Well, thank you, Julia, for an excellent presentation. And congratulations on the great work that you've done in terms of the development of competencies for primary care nurses. That's very exciting work that you've undertaken, and I think it will have great benefits. So I do open that up for questions. If you have any question, please document your question in the question and answer part of your screen. And once you finish typing your question, make sure you click the send button so that we can see your question. But I invite you to come forward now with your questions. So I really appreciated the work that you've done, Julia, in terms of the development of the competencies. I'm wondering if you can speak a bit further in terms of, coming from an educational position here, obviously very interested in how this would be integrated into our curricula. And you touched on that a bit. I wonder if you could comment a bit further in terms of you're saying that this would be appropriate for both undergraduate and graduate programs. Perhaps you could just talk a bit further about that.
Sure. Yeah. So we know that in general, primary care is typically covered within community health courses. in undergraduate curriculums. There are few faculties of nursing or schools of nursing that have included courses in their undergraduate program that are specifically focused on registered nurses in primary care and that role and education in that area. So by having competencies that reflect this unique role, we can now look at those courses where that content is included, and it will create opportunities to better integrate content that reflect the national set of competencies that have been developed. The competencies for registered nurses in primary care build upon entry to practice competencies. So it's not expected that these competencies are going to be covered to the full extent in undergraduate nursing programs, but it is an opportunity to further integrate it. Many nurses who, when they graduate, we know they go into acute care and eventually transition into community health nursing roles or primary care roles. So we can help with promoting primary care in this role by having these competencies introduced at the undergraduate level. At a postgraduate level, there's opportunities to create certifications for registered nurses. These competencies could also be utilized by existing family practice nursing postgraduate programs to update their own competencies. And there's so many different opportunities to engage in research and evaluation. These competencies at a graduate level would provide nurses with opportunities to evaluate the process of registered nurses. So when you think about looking at nursing in primary care, there's a lot of discussion about evaluating roles, defining the role, and also measuring outcomes. So these competencies help target that process component of registered nursing in primary care. Some of the next steps to help further define the competencies will be now to better define specific roles and activities and where they fall underneath the different competency statements and domains. Ethan, does that answer your question?
That's great. Yeah, that's great. Thank you very much. So I have a question from Wendy. She says, great job. Looking forward to seeing competencies. When do you think exam will be ready?
Oh, that's a good question, Wendy. So this work is being led by the Canadian Nurses Association in collaboration with community health nursing stakeholders. So I am actually not sure when the date is what the date of completion is. I would need to follow up with CNA or encourage you to connect with CNA to find out that information. But it is in progress, and it's moving forward. So I'm not sure if it will be ready for the next round of exams or if it's going to be implemented in the future. So fortunately, I'm not comfortable speaking to a specific date.
Okay, thank you. And again, just a note to the participants, feel free to also make comments if you have comments as opposed to questions, but we invite you to just submit your questions, and Julie would be pleased to answer them. It's such exciting work. Just wondering, for the current primary care nurses, so these are competencies, I gather, reflect their current practice, or will there be a fair bit of development required on even current primary care nurses?
That's a good question. Again, thanks, Nita. So that we're hoping to get some information about that in one of those national surveys that I described. So the survey will be distributed to family practice nurses across Canada to identify whether or not the competencies in the set are being actualized and whether or not they feel that they could benefit from further learning or knowledge in any of the different competency areas. So through that survey, we'll be able to both validate the competence statements that were developed and better answer that question. My hypothesis is that there's certainly going to be areas that could be further developed by family practice nurses. However, the primary care practices, we know, vary and differ across jurisdictions from practice to practice. So it's likely that not every primary care nurse will be engaged in all the different competencies that are identified in the report, because they do range from leadership to clinical practice and research and evaluation. So it covers the broad role of primary care nursing. Right? So there may be opportunities identified by nurses. Yeah, does that answer your question?
Yes, thank you. And again, just in regards to the approach taken, I really appreciate the approach that has been taken. I think it's really clear, and it provides a nice framework, having those 6 domains within which those competencies are framed. So I think it's a great approach. So it'd be great to see the further feedback that you get through the upcoming surveys.
Absolutely.
Are there any other questions or comments from our participants? Are there any other aspects that you'd like to have this discussed further, Julia, with us? Perhaps that have just come to mind during this presentation? Anything to add?
No, I think I just wanted to maybe take one opportunity again to thank all the project partners, and it's been incredible working all the different associations involved with this work and having support. I think this is a really exciting time for registered nurses in primary care, and hopefully through having competencies over the next year and upcoming years ahead, that this role will be better understood across Canada by both patients, providers, and policymakers, and lead to further opportunity for this workforce to contribute to patient care.
Yes, thank you for that. I'm just wondering also, do you have any particular plans within your institution at Queen's in terms of the integration of this work into the curricula, or even in terms of clinical placement opportunities perhaps for students in this area?
So I'm actually at Memorial University in Newfoundland right now. Yeah, and Newfoundland is one of those unique provinces where I moved here from Queens in Ontario, and I moved to Newfoundland to one of my key research interests is to evaluate outcomes that reflect the role of registered nurses in primary care. So identifying what the indicators and outcomes would be to measure effectiveness of this role within a primary care team. But I quickly learned when I moved to Newfoundland that this role is not quite established yet. There's very few registered nurses in primary care. A lot of primary care in Newfoundland is led by physicians and without team-based care. So it's definitely, I work closely with policymakers here in Newfoundland and different stakeholder groups, and my institution have lots of discussion about this, but there's still lots of work that needs to be done. There's barriers with respect to funding models and integrating this role into existing funding structures. So once that can be overcome, then it will provide opportunity for increased placements for students and work opportunities. But at this time in Newfoundland, it's still quite in its infancy, I would say.
Okay. Good, thank you. I'll just check back in with our participants. Are there any further questions or comments from our participants? Well, hearing none, I just want to thank you again, Julia, for an excellent presentation and congratulate you on the great work that is being done, and really look forward to the next steps that you've outlined for us. Obviously, there's still further work to be done, but it's exciting work, and really look forward to the results of your further surveys and the certification exam. I think that's going to be great opportunities for our nurses. So thank you so much for your presentation, and just open up in case you have any final comments to make.
No, I have no further comments. Thank you, Neetha.
Okay, I just see Wendy's just coming up with something, so just hold on for a moment. Unfortunately, only part of your question came through, Wendy. You might want to just check again on your question. Okay. Unfortunately, the rest of her question isn't coming through at this point.
My email is there if anyone does have any questions or comments, and if you want to connect with me afterwards, please don't hesitate.
Okay. Excellent. Well, thanks again. Then I'll conclude our session for today. And thank you again. And thanks to all our participants. We really appreciated you being part of this session today. Please note that the recording of this session will be made available on CASN's YouTube channel and circulated to you in the coming days. So please feel free to share the link within your networks. And again, thank you everyone, and CASN certainly hopes that you'll consider attending future Lunch and Learn sessions this winter and spring. There is a whole series of sessions planned, so please check CASN.ca for further information on the series of Lunch and Learn sessions. So thanks again for participating, and have a wonderful day.